Welcome back, everyone. For those of you who are new, my name is Dr. Vinay Samuel Gaikwad. I'm the Associate Director and Head Surgical Oncology at Pancreas Hospital, Gurgaon. Today, we're going to be discussing esophageal cancer or cancer of the food pipe. If somebody has difficulty in swallowing, what we want to discuss is that esophageal cancer. So, coming to the first part of our session today is the question is, what is the esophagus? We're talking about the food pipe. So it is a hollow muscular tube that connects the throat to the stomach. Esophageal cancers are basically two types. There are many other rarer types of cancers, but we divide them into mainly squamous cell type and adenocarcinoma types. So we can divide the food pipe, which is a long tube, into basically three sections or three thirds, the upper, middle and lower third, and that is how we as oncologists look at the esophagus and cancers of the esophagus. So what are the risk factors that lead to esophageal cancer? One is the older you are, the higher your risk of developing food pipe cancer is. Males are more predisposed, probably due to habits such as tobacco and alcohol intake. Gastroesophageal reflux disease or GERD, that is something when the acid in the stomach comes back up into the food pipe, repeatedly causing an insult to the lining of the esophagus, that can also lead to esophageal cancers. There's a disease called Barrett's esophagus, in which there's a change in the lining of the lower end of the esophagus, which then can move and develop into cancer. Being obese or overweight is also a risk factor, and something called achalasia cardia, which is a disease, can cause esophageal cancer when it's long standing. Diet rich in processed food, meat, very hot fluids can also cause esophageal cancer with time. It's not to say that you will always get it, but it is a risk factor. Diseases like tylosis, which is thickening of the hands and feet, the skin on the hands and feet, which is a hereditary syndrome. Plummer-Vinson syndrome, somebody ingesting acid or alkali by mistake can also lead to esophageal cancers. And if you have a history of other cancers, or even the human papilloma virus, which is gaining popularity now, that is also a risk factor. So how can we decrease our risk? It's simple: avoid risk factors. So avoid tobacco, alcohol, get fit, stay fit, treat any predisposing diseases like reflux or Barrett's esophagus, and avoid even the other risk factors we just mentioned. So just because we avoid risk factors does not mean that we have no risk of developing it, but our risk will be minimized. Can we detect esophageal cancer early? So screening is something that we do to the general population to see if they have something that we need to be concerned about. But in esophageal cancer, there is no good screening technique. But we can test people at risk. If you are a known person who has Barrett's esophagus or one of these inherited syndromes that we mentioned, then it is worth getting tests like a barium swallow, an endoscopy, a CT scan, or even sometimes a PET scan if there's a very high chance of you developing or thinking that you might develop this cancer. So an endoscopy is something that we have to concentrate on. It is just a tube placed through the mouth, a very simple procedure which is the best way to detect this cancer. What are the signs and symptoms that we might face if we have this? The foremost sign is difficulty in swallowing. First, it's usually because we can't swallow solids like rice and roti and so on. We are having difficulty, but we are able to take liquids, and with time sometimes it moves on to inability to swallow or difficulty in swallowing even liquids. We can have chest discomfort, weight loss, loss of appetite, sometimes even a hoarseness in our voice, and chronic cough, bone pain, and even bleeding. We might vomit out blood. So these are some of the common symptoms of esophageal cancer. The treatment of this disease is quite complex, and it should be multidisciplinary. That means multiple oncologists, such as the medical oncologist, surgical oncologist, radiation oncologist, even the nuclear medicine person, pathologist. Everybody has to be involved in the treatment to ensure you get the best treatment of this disease. Most of the time, since most patients come to us later on, we end up having to, even if the disease is localized, end up having to give either chemotherapy or chemo radiation before we operate the patient. The operation is relatively straightforward. It is can be done in minimally invasive techniques like keyhole surgery, and we most of the time have to kind of mobilize the food pipe through the chest, and then we also mobilize it through the abdomen, and then usually most of the time we join it back in the neck region, but that is something that you can discuss in detail with your surgeon. Also, many times we might have to give radiation, which is relatively well tolerated, and many times the symptoms of the cancer get solved even before we operate, like the patient is able to eat and drink quite well before the operation. There are many other therapies like targeted therapy, immunotherapies, which can all be used to help patients have a better life with this cancer. But it is a very dangerous disease, and we have to keep a lookout. It's better to detect these diseases like esophageal cancer early, so that we can treat them early and therefore get the best outcomes possible. So I hope this small session has helped you understand what esophageal cancer is and how we can detect it, what the signs and symptoms are, and how we can treat it. So basically, if there's difficulty in swallowing, I think it's worthwhile to visit especially a gastroenterologist and maybe get an endoscopy and make sure that everything is fine, to rule out especially this disease called esophageal cancer, which should be detected as early as possible. So thanks for watching, and I hope this has benefited you, and stay tuned for more videos.